and extend my remarks, and I yield myself such time as I may consume.
Without objection.
Madam Speaker, I rise today in very strong opposition to H.R. 3134 and H.R. 3504, and in very strong opposition to the underlying closed rule. Today, the House should be debating a bill to keep the government open before funding runs out at the end of the month. We have just 6 legislative days before there is a government shutdown. 6 legislative days. And instead of tackling this, we are once again debating another Republican attack on women's health. I mean, in 6 legislative days, the government might shut down. And I'm worried because judging from recent events within the Republican caucus, the right hand doesn't know what the extreme right hand is doing. They can't seem to get along with each other. And I'm afraid yet there'll be another catastrophe and everything will come to a halt. And the people that will suffer will be the people of this country who we're supposed to represent. And, Madam Speaker, in fact, the Republicans were in such a hurry to waste our time with this destructive legislation that one of the bills we're considering, H.R. 3504, had no hearings, not one, none, no markup, and this is the first time we're seeing the bill. And no amendments, by the way. Nobody can offer an amendment. Totally closed. Whatever happened to regular order? This process, Madam Speaker, stinks, and it is indefensible. Of all the measures that have come before the Rules Committee, more than 75% have completely ignored regular order and were rushed to the floor without a legislative hearing and markup, denying the people's elected representatives the opportunity to hear the experts and speak up for their constituents. Well, when you look at the politically motivated legislation that regularly comes before this body, I guess it's easy to see why. This is not how the People's House is supposed to work. And late last night, the Republican majority in the Rules Committee took another shortcut through a process called self-executing and let them slip in an amendment offered by Ms. Elmers into today's legislation to redirect funding away from Planned Parenthood facilities. Under regular order, this amendment would have required 3 waivers. 3. It would require 3 waivers from the committee to be considered on the House floor. On top of that, the Elmers Amendment would have also violated Section 302F of the Congressional Budget Act, which prohibits the consideration of legislation that exceeds a committee's allocation of budget authority. But the Republican-controlled Rules Committee said, who cares? You know, we're in charge. We don't care about the rules. We don't want to be fair. We don't want to be open. We don't want to be transparent. We're in charge. We can do whatever we want. This is just another attempt by the House majority to shut out debate on important issues and ignore the House rules when it's convenient for them. During this Congress alone, 118 waivers have been granted. 115 of those waivers, 97%, have been for Republicans. And instead of the House Rules Committee, we should be known as the House Break the Rules Committee, because that's all the Rules Committee seems to do. It breaks rules and goes around rules and tries to all kinds of trickery to be able to force legislation to the floor that limits debate and doesn't allow members to offer amendments. This legislative process in this House has become a joke. It is shameful, and this is not serious legislating. With one bill after another, Republicans have repeatedly hurt our country's most vulnerable families, and these bills today are just the latest chapter. And this is nothing new. One of the first acts of the Republican House majority in 2011 was to drive us to the brink of a government shutdown over Planned Parenthood. In October 2013, the Republicans did shut down the government by insisting on defunding the Affordable Care Act. And now, 2 years later, they are right back to threatening a Republican government shutdown over Planned Parenthood. House Res H 3134, the so-called Defund Planned Parenthood Act of 2015, is a bad and a backward-thinking bill. In the 114th Congress, the House has already taken 4 anti-women's health votes, and today sets the stage for us to take 2 additional votes to restrict access to women's health care. Incredibly, this is already twice the number of anti-women's health votes that at this same point in the 113th and 112th Congresses. And this Congress is not even half over. And in this Republican Congress, facts don't matter. We don't talk about facts. They're inconvenient, and they're a nuisance, especially when they get in the way of their extremist political agenda. The fact is that Planned Parenthood plays a critical role in protecting and providing access to critical health services for both women and men. 1 in 5 women has relied on a Planned Parenthood health center for care in her lifetime, and Planned Parenthood serves 2.7 million patients each year. And one of the most important statistics that my Republican friends like to ignore is that more than 90% of what Planned Parenthood does nationally is preventive care, including cervical cancer screenings, breast cancer screenings, and family planning, not abortion services. You know, I just come from a luncheon a few minutes ago where we were honoring individuals who were leaders in the cancer prevention field, people who have advocated that it is important for all of us to be able to get checkups on a regular basis in order to prevent cancer. And here we are, about to vote on a bill that, if the Republicans get their way, would limit and would eliminate access to life-saving cancer screenings for countless individuals across this country. What are you thinking? This is not the way we should be proceeding. And add to this fact that Planned Parenthood clinics are often one of the few affordable health care options available for many women. Nearly 80% of women using Planned Parenthood clinics have incomes at or below 150% of poverty. And it's easy to see why a majority of Americans don't think federal funding should be eliminated. In one recent poll, 63% of voters, including 72% of independents, do not agree with my Republican friends that federal funding for Planned Parenthood should be eliminated. Madam Speaker, we have also heard very little from my friends on the other side of the aisle about the consequences that defunding Planned Parenthood would have for families across the country. One of the biggest myths perpetrated by Republicans is the idea that the nation's community health centers, which I love and adore and respect and support, could somehow magically pick up the slack overnight if Planned Parenthood is defunded. For the millions of low-income women who depend on Planned Parenthood clinics, this scenario would mean the loss of affordable and accessible contraceptive services and counseling, as well as breast and cervical cancer screenings and testing. The idea that our community health centers could overnight suddenly step up and cover millions of new patients is simply wrong and shows a fundamental misunderstanding by Republicans on how our country's health care system works. In fact, the Guttmacher Institute recently found that in 21% of counties with a Planned Parenthood health center, Planned Parenthood is the only safety net family planning provider. The report also states that in 2/3 of the 491 counties in which they are located, Planned Parenthood health centers serve at least half of all women obtaining contraceptive care from safety net health centers. In 1/5 of the counties in which they are located, Planned Parenthood sites are the sole safety net family planning center. This makes clear just how devastating it would be for these communities to recklessly cut funding for these vital health services for the people who need them most. You know, everyone here in this Congress, every single one of us, with the snap of our fingers, can get health care. But with today's bills, Republicans seem to be saying that for families who are poor or who live in rural areas or where this is the only option for preventive care and where they live, you're simply out of luck. Talk about cruel. Madam Speaker, I have a recent article from the Health Affairs blog entitled "Planned Parenthood, Community Health Centers, and Women's Health, Getting the Facts Right." I quote from that. A claim that community health centers readily can absorb the loss of Planned Parenthood clinics accounts to a gross misrepresentation of what even the best community health centers in the country would be able to do were Planned Parenthood to lose over 40% of its operating revenues overnight as a result of a ban on federal funding, end quote. I ask unanimous consent to insert the full article in the record.
Without objection.
Here are some more facts. For every patient served by a community health center today, nearly 3 residents of low-income communities remain without access to primary health care. By voting a sudden cutoff in funding, we would create an immediate health care access crisis for millions of women, placing enormous strain on community health centers and other providers. And community health centers offer women's health services as part of a comprehensive primary care programs. They simply cannot put their other responsibilities aside. You know, with so many of our nation's community health centers already struggling to meet the needs of our most vulnerable communities, the last thing we should be doing is trying to make their jobs harder. Now, on top of all of this, Senator McConnell has already said that Senate Republicans do not have the votes to pass this bill, and it will never reach the President's desk. So what are we doing here? This is not a rhetorical question. We are literally, as I said earlier, we are 6 legislative days away from another government shutdown. And instead of talking about how we're going to keep the doors open, how we're going to do what the people of the country have sent us here to do and keep government running, we are wasting time with this politically driven legislation that does nothing to make the country better. Madam Speaker, the other bill before us, H.R. 3504, is not a simple restatement of the current Born Alive law, by the way, which passed by a voice vote in 2002. No, just so my colleagues understand, this bill fundamentally interferes with the sacred doctor-patient relationship and undermines doctors' clinical judgment and tells them how to provide medicine, or else they will face criminal penalties. Madam Speaker, this bill is a solution in search of a problem. We already have strong federal and state laws that protect babies born alive. Look, the bottom line is that these anti-women's health bills would limit women's access to safe, legal, reproductive health care. Congress should be governing responsibly and working to solve the real issues our country is facing. We should be focused on growing our economy, creating jobs. I think you may have forgotten that that's an important priority of the American people because my friends never like to mention the word jobs. But we ought to be focused on creating jobs. We ought to be protecting access to health care, increasing college affordability, and building a better future. Instead, 30 conservative House Republicans have decided to take government funding hostage, and that's what we're here for. The American people deserve better. And finally, let's be clear. Let's all kind of clear the air and be honest about one thing. The debate we're having today really isn't about the quality of care provided by Planned Parenthood. That's really not what's at the heart of all this. This is an effort by my friends on the Republican side to kind of pursue their agenda of criminalizing and outlawing abortion in every circumstance. Many of my colleagues on the other side have been very vocal about the fact that they want to criminalize abortion even in cases of rape or incest. They would make a woman who is a victim of rape or incest a criminal. They would criminalize the doctors. That's what this is all about, trying to force their narrow agenda down the throats of the American people. I would say to my colleagues that we ought to reject this and get down to the business of governing this country. This is not what we should be doing here today. This is an insult, I think, to women. This is an insult to the good people who work at Planned Parenthood, who provide excellent care to millions of people across this country. And quite frankly, it's an insult to the American people that with 6 legislative days left before you shut the government down, this is what you choose to bring to the floor, and not a bill to keep the government open. And with that, I reserve the